Hello and welcome to the Multicultural Media Forum, hosted by the Ministry of Health, Multicultural Health Communication Service, together with the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for these sessions. And today we're so pleased to have with us the Honourable Ryan Park, Minister for Health and for Regional Health, who's joined us today. Minister Park, how are you?
Yeah, very good, and very delighted to be here with you and Dr. Chant.
Thank you so much. And of course, we have Dr. Kerry Chant, New South Wales Health Chief Health Officer. Dr. Chant, it's nice to see you again here.
Good afternoon, and it's great to be here.
Thank you very much. Before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and pay respects to our Aboriginal colleagues and communities who are joining us in this session. We also pay respects to leaders and elders of multicultural communities and refugee communities represented in this session. As we have Minister Park and Dr. Chant today, would like you to ask your questions. Keep your questions and thoughts on the chat, but please keep your microphones on mute. We have 30 minutes today to answer all the questions that you have. And our focus today, of course, is on respiratory illness. And with winter approaching, the topic is respiratory illness and what we can do to protect ourselves and our families. And Minister Park and Dr. Chant, last week I was sick and I stayed home. I made sure that, to make sure that when you're unwell, to keep away from others. But it is the time when people are getting sick. And so we would like to find out what we can do as following immunization, World Immunization Week, which ran from the 24th and 30th of April, and the impact vaccines have had on the countless lives over the years. So we'll start. Dr. Chant, last year you and Minister Park launched the respiratory illness campaign. Can you tell us why this is so important?
So as we've moved out of COVID, what we're trying to do is normalise the fact that every winter, generally, we see a resurgence of a number of respiratory viruses. And but the measures to protect ourselves are often similar. So, for instance, Jess, it was great to see that you stayed at home when you're sick, so not sharing your germs. You would have been particularly cautious of not going into aged care facilities or hospitals to visit loved ones who are particularly vulnerable. You may not have got a test, but you knew where to ring if you had your symptoms got worse. And we also know that immunisation, particularly against influenza, now's the time to get it whilst activity for flu is low. It takes a little while for those vaccines to work, so please get your vaccination now. And also a message that COVID, whilst it's currently at low levels, we are expecting future waves. So again, refer to the ATAGI advice or the advice on our website, ask your doctor, ask your pharmacist, and make sure you're up to date with that latest guidance.
Thank you, Dr. Chan. And I did get tested and it did say negative. And that rat test is really important so that you feel safe as well, that you know that you are not feeling that you are sharing any illnesses.
So it's really important that the community recognises that those rapid antigen tests have served us really well. But it's important that if you have any underlying health conditions and your doctor may want to know exactly what's causing the illness, because for a few conditions like influenza and for COVID, there's some antivirals. So there's some medication we can give you. So for most people, doctors will treat you on symptomatically, like they'll say rest, make sure you keep your fluid uptake, reduce your fever, those general health measures. But if you're at risk of severe disease, even if you start off with a very mild symptoms, the doctors may want to know what virus you've got because they might want to give you these antivirals. So that's another message, that if you have got underlying health issues, if you're elderly, please check with your doctor. So you've got a plan ahead of this winter. You have a pathology request form that will enable you to get that more precise testing, and that you will then be able to link in and get those antivirals if it's indicated.
Thank you, Dr. Chant. Minister Park, what is your message to the community about respiratory illness and influenza in particular?
Well, it's really simple. It's a number of stages. Firstly, in relation to influenza, I can't stress enough what Dr. Chant has talked about, and that is the importance of vaccination. Now, that's available through your GP, it's available through your pharmacist, and it is easy, simple, and it's pain-free. And it's absolutely paramount that we have a really high number of people in the community who are vaccinated. That provides protection, not just for them, but it also helps to protect vulnerable members of our community through that herd immunity concept. And that's really important, step one. Step two is if you start feeling symptoms, please do exactly what you did. Stay at home, stay away from people. But importantly, from our perspective, I've got to be honest, please stay away from vulnerable settings. Now, that's aged care settings. It may be people with a disability in supported homes. It may be hospitals, those types of settings where vulnerable people are in our community. It's absolutely imperative that you take responsibility and do the right thing and make sure that if you have any of those symptoms, stay at home. And finally, as parents, opportunity to make sure we're on the lookout for this type of illness in our young children and making sure that if we see it, notice it, pick it up, make sure that we can access care, but importantly, keep them at home as well to try and stop the spread during the winter season.
Park, and we do have video messages, and we have in partnership with a lot of GPs and doctors from the community, we have engaged with them to deliver messages on how to the importance of vaccine. And here's a video that we'd like to play for you.
Influenza, also known as flu, is serious, especially for babies and young children. That's why the flu vaccine is free for children aged 6 months to under 5 years. Vaccination helps keep your kids healthy for playdates, family holidays, and everything else. It's quick and easy to get your children vaccinated and protect them from getting very sick. Book their flu vaccine today with your doctor.
Videos are available on the New South Wales Multicultural Health Communication Service platforms, social platforms, as well as New South Wales Health. So please share them. And our colleague from MHCS will be sharing the links on the chat as well. We're reminding you to please ask your questions for Minister Park and Dr. Chant here so that we could answer your questions. Dr. Chant, we've heard so far about the importance of everyone getting their influenza vaccine. We heard Dr. Aju say that too. But what exactly is influenza? And what is this virus?
So influenza is a virus, and we tend to call it flu, which sort of underestimates the impact. And we often use the generic term flu when we might mean a mild illness, which might be the common cold. So there's a variety of respiratory viruses that really impact us, but the three main ones are COVID, RSV, and influenza. Influenza, as you heard from the GP, can be very severe, particularly for the very young, those that are elderly, and those with underlying health conditions. But even healthy young people can have significant side effects associated with influenza, and it also can predispose them to other bacterial infections. So it can be a severe illness for many.
So who can be impacted by influenza? You mentioned that the elderly earlier as well, the young children. So what could parents do to prepare for this?
The main message for young children, for parents of children over 6 months to under 5 years, is there's a free vaccine. So please avail yourself of the vaccination. I know that there is a lot of, it's a very crowded schedule and lots of visits and lots of vaccines. But one of the things that we've heard at a recent community event was concerns that that somehow the immune system can't cope with that. And I just want to reassure everyone that our immune systems can combat many challenges, and really the flu vaccine is very safe and effective in young children, and getting flu is much more severe and likely to cause hospitalisation and severe impacts for the child.
Thank you, Dr. Chant. Minister Park, we've talked about how important it is for winter, but why is it important for the community to get vaccinated right away?
Well, it's important because, as Dr. Chant has advised me and others, that we get roughly around 6 months worth of immunity from vaccination. And that's why Dr. Chant and I launched the flu program or vaccination program last week. That's when the majority of doctors and pharmacists were starting to get their supplies. But also, it meant that essentially, from my perspective, I've got now that vaccination period into October to try and provide me the most coverage over the most difficult months, which is our winter period. But it's not only important for me as an individual. I think we also learnt during COVID how important it is that we look after ourselves for other vulnerable members of our family or of the community. And that's something that I'm continually telling people is absolutely critical. Some people say, well, I'm healthy, I'm fine. If I get the flu, not too bad. The reality is what we want to try and change that perception and view of the world and make people understand that by getting vaccination, by not getting the flu, we're actually helping protect others that might be vulnerable in our family or in our community. And I think that is something that we can do easily, and it is something that we should be doing, particularly as we head into what is always a challenging winter season for our hospitals and our health services.
Children as well. It's so important to be sharing that important message.
Yeah, it's critical. I know my 2 boys have got their flu vax. I'm very, very, like Dr. Chant, supportive of the role vaccination plays in our health system. In New South Wales and in Australia, vaccination is safe and it works and it's effective. And we've seen that during COVID. We've seen that a range of different other illnesses. And it's really important that as parents, we also take that role and take on that responsibility to make sure we're doing everything possible to protect our children during these winter periods.
Thank you, Minister. Dr. Chant, a lot of people say that they got the flu because, and they got sick because of the flu vaccine. What do you say about that?
So the vaccine is not a live vaccine, and so it can't give you influenza. But what happens is people are often getting vaccinated when there are other respiratory viruses around. And so it may be that you do get unwell, but it could be a different respiratory virus. Or also when people leave it a little bit later, when there's a lot of flu activity, you might have actually been exposed to flu, got flu, and your immune system didn't have enough time to respond to the vaccine. So hence why we're saying now is a great time to get it. When flu activity is low, we know it takes around 2 weeks for that protection to build up in your immune system. So go out and get it now, and then that will give you that protection over the winter months.
And Dr. Chant, if you have been unwell, could you get the flu after you get better?
If you're unwell, there are many respiratory viruses that cause very similar symptoms. And particularly, unless you've got a test, you really don't know. And we're not recommending that everyone needs a test. It's really around symptomatic management for most. And the only time you would need a test if it was clinically indicated, if your doctor wanted to know what you had for the purposes of managing you.
Yeah.
But for most, with respiratory illnesses, it's around taking those prudent precautions, stay at home, try not to share and spread your germs around, rest, keep hydrated. And if there are any signs of deterioration, call your GP, call Health Direct, and get some advice around what other care pathways you might need to follow.
Yes, and as we've reminded before, Health Direct, if you need language support, you can call the national TIS line, which is 131450, and then Health Direct. Now, Dr. Chant, influenza flu vaccine is safe.
That's correct. Like all vaccines, all medicines, there are risks and benefits, but clearly we have a very safe vaccine that has been used for many, many years. We have a very robust surveillance system for adverse events. So we do want to reassure the community. There are a couple of contraindications to the vaccine, but they're very, very limited. So we're very blessed with a very safe vaccine.
Thank you, Dr. Chant. Minister Park, what other ways can people protect themselves, their families, and communities?
Yeah, well, what we learned during COVID is the importance of hygiene, and particularly hand hygiene. So that's making sure that we're doing those basic things that I'm sure we've all taught our children. And that is when we use a bathroom or a toilet or we're out and about, making sure that we're regularly washing our hands, making sure that if we are not feeling very well, we're staying at home, making sure that we're not going into where vulnerable members of our community or our family are. So that might be simple things like not asking the grandparents over for a weekend if someone in that family is not feeling well. And I know that can be very difficult, particularly with elderly loved ones, but you're actually doing them a really, really good service by not exposing them to what could potentially be a very life-threatening illness in influenza. And Dr. Chan is right. Even over the last week, as I've moved out and about in my community, people have talked to me about seeing Dr. Chan and I on TV getting our flu vax, and sometimes mirroring this with general cold and respiratory issues. It's not that. It's not all sniffle nose. It's not just the cold. Flu can be very, very serious and can actually cause death in people who have got vulnerabilities and health vulnerabilities, and we need to take it seriously. So it's about making sure that we're doing those hygienic things that we all learnt so much during COVID, making sure that we're staying at home and not going to work or not going out and about in the community if we've got those symptoms. And of course, making sure that those in our care, like our children, that we're looking after them and paying attention to what could be their symptoms that they experience. And if we see that, then acting on it in the way Dr. Chan explained earlier.
Probably also useful to say that when we've got the flu season and our report, we do put out a report every Thursday, which gives the community a sense of what the activity is occurring. But if we do see that sort of uptick in flu, and at the moment we're saying RSV activity is quite high, it might also be prudent if you've got those visits for loved ones, particularly if they're very vulnerable, to think about having the barbecue outside, to think about those well-ventilated places, because some of the infections are infectious before the person gets sick. So again, some of those prevention activities are around choosing the sort of setting in which you're entertaining, and think about if you've got elderly relatives that have got health conditions, keeping it outdoors or in well-ventilated places as well.
So planning ahead.
Please keep connected, because the last thing we want is to see people not engaging and socially isolated. So there's really very safe ways of entertaining. Obviously, if you're sick, that's a time to defer. But just think about those sort of more outdoor environments. And most of the time we have quite a mild winter. So keeping those, using verandas or parks or those sort of settings are very safe, particularly when you've got lots of generations together.
Yes. And Dr. Chant, one of the things that we all know is we go to the GP to book to get vaccinated. And pharmacists are now a place we could go and trust them to do our vaccination.
Absolutely. So just to really clarify that vaccination, if you are eligible for free vaccination and you're over 5, you can get that free through the pharmacy. So the Commonwealth Government has provided some funding to the pharmacist to pay for the administration fee. And the vaccines are provided under the Commonwealth National Immunisation Program. So just to reassure people that the pharmacist is a really good setting to get vaccinated, and also to reassure them that that record is visible to your general practitioner. And so there's no breakdown in that integration of care. And we're working very much with our pharmacists and GPs to see that both have key roles to play in that primary care sector.
Thank you so much. And then we've talked a lot about influenza. Is there anything we should be aware of? You talked about the big threes, which is RSV and COVID. Is there anything that we should be aware of with those 2 other viruses?
Clearly, RSV is a respiratory syncytial virus, but colloquially known as RSV, can cause a inflammation of the lining of the tubes of the lung, of what's called bronchiolitis, and that can often lead to a wheezing illness. It's mostly younger children. We are rolling out at the moment a program of what's called passive immunisation for our very high risk and vulnerable newborn babies, where this is their first RSV season. That will generally be accessed through the hospital system or referral. And also it is available through our Aboriginal medical controlled services.
Thank you so much, Dr. Chant. And again, if you have any questions, please put them on the chat, and resources and links are on the website and on the chat for you. So please, we have Minister Park and Dr. Chant here to answer questions. Now, Minister Park, it is important to have resources available for the communities, and there are resources for culturally and linguistically diverse communities.
Yeah, it's absolutely important. The New South Wales Health website and our social media channels are a treasure trove of good, reliable, evidence-based advice. Now, one of the challenges in this day and age where information is so easily accessible is getting accurate information. And what I say to people all of the time is if they're looking up symptoms, if they want to find information relating to healthcare in New South Wales, please go to New South Wales Health website, contact Health Direct, that is the national type of system that we all contribute to, but they are two reliable sources. You don't have to go further. The information on New South Wales Health's website is evidence-based, it's accurate, it's reliable, and it's effective. And that's what we need people to interact with. And it's the same with Health Direct. It's easy for people to get this information. If you need more information, obviously you can contact New South Wales Health, but these materials are designed to make it as easy for you to pass on information to other members of your community or other members of your family. And I think that is a really important part of what we're trying to do here today, is making sure that people are aware there are trusted sources, they are reliable in terms of the information, they're information that is evidence-based and effective, and it's available through New South Wales Health, through our social media channels, and also through Health Direct.
Minister Park, in terms of the health staff, it's just as much as important to share that with the other staff for them to share with their communities as well, isn't it?
Yeah, it's critical. Healthcare workers and professionals are thought of very highly in our country and in our state, especially after 3 years of very, very difficult conditions during a global pandemic that was COVID. And what we need those people to be is champions of that message, champions of vaccination, and champions of accurate, reliable, and up-to-date information. No one's doubting there's a lot of health information out there in the World Wide Web. Tragically, a lot of it is not accurate. A lot of it is not evidence-based. And what we're trying to do is make sure that people in our community, people with a core background within our community where English may not be their premier or frontline language, we want them to be able to access information as well. So it is available through translated sources. It is reliable, it is accurate, and we're asking people both within our health team and outside to make sure that you're spreading that message and using those reliable sources.
Minister Park and Dr. Chant, misinformation is out there, and how do we deal with that?
I think we heard in a previous session we'd had with some of the called media that one of the things that's really powerful is for health practitioners speaking to their communities in language. And so it's really been great to acknowledge the work that you've done, Jess, and the team in identifying those spokespeople and having that as in our toolkit. But I think we really heard about the benefit of having healthcare workers lead that discussion with their communities.
And also being able to reach out. One of the things that they said as well was that the community members be able to come out and share their stories as well.
That's right. So hearing that powerful messaging and imagery where community members stood up and gave that information.
Yes, and I guess, Minister Park, in terms of the support of the multicultural media, that's been, I mean, we've been here with the support of multicultural media for a few years now, since COVID started, Dr. Chant, and it's just that they've become champions as well, and how their role is so key in delivering these messages.
Well, I can't stress enough the importance of our multicultural media and the role they play when we're faced with healthcare challenges. And no more was that seen than during the 3 years of the pandemic, but it needs to remain in place. I'm extremely grateful as a health minister that we have a really active and vibrant multicultural media. And Jess, you and the team do a fantastic job in supporting, making sure that accurate, reliable and up-to-date information is getting out there. And I want to thank them on behalf of not only the government, but the entire New South Wales community for the role they play. Because Dr. Chan is right. when healthcare professionals are speaking in language to their community, of course, it carries great weight. The same way can be spoken about multicultural media. They're a trusted source of news for many different communities across New South Wales. And I know, having spoken to a number of my parliamentary colleagues, just what an important role they play as a part of the healthcare system that we provide. And I want to thank them. I want to thank them for making the effort to get up-to-date, accurate, reliable information, and having people like Dr. Chant and other healthcare professionals speak about the importance of vaccination and other things that can easily be misconstrued, and misinformation can arise on these things right across the World Wide Web, and that flood of information that's available to us. Multicultural media play a really important role in making sure those accurate messages, those reliable messages, that evidence-based messaging is out there amongst their community, so that the community can make a really, really positive decision about their healthcare.
And Dr. Chant, in terms of what is next, what are we wanting the community to do and for people to watch out for?
So I'd really like to see higher rates of vaccination, particularly in over 6 months to under 5 years of age. We really, year in, year out, just been sitting around 30%, and that's very low. You know, where our targets are really seeing that double. I'd love it to see up about 60%. So that's a bit of a challenge to the community. We do much better with our over 65s, but again, there's big room for movement. We, sit somewhere between 60 to 70%, depending on the region. And I think, again, we can do better. So I would just like to see us nudging up our immunisation coverage. I'd like to see us showing that care and compassion to each other, thinking about how we all can play that small role as part of the whole in slowing the spread of respiratory viruses, and those simple steps that we can take individually to support our loved ones and the broader community.
So we've heard that from Dr. Chant. She's asking us to go out there and deliver those messages. One of the things that we've heard from in terms of consultations with the community on respiratory illnesses, we found that a lot of people go for vaccination when they go to travel and travel overseas. But it is important that even more than that, it is important just even when you're here in the country as well, isn't it?
That's correct. And some of the interesting feedback from community was also to many people seeing returning to homeland as not travelling because it's returning home. So again, our language needs to reflect and resonate with community. There are many vaccines that are recommended for when you travel back, be it on home or on holidays. But there are many destinations for which we have a different profile of illness and some different vaccines. So again, speak to your doctor, speak to your pharmacist. The pharmacist can give you the vast majority of those recommended vaccinations. There may be a cost, but the last thing you want to do is interrupt your holiday, interrupt your time with family and friends. So take that preventative action.
Yes. Well, thank you, Dr. Chant. And Minister Park, we've run out of time, but any last words that you'd like to tell the community, the health workers who've joined us online as well?
No, just to thank you and Dr. Chant, but also thank you to literally the tens of thousands of healthcare workers who are out and about right across our hospitals and health facilities and community health services, supporting the messaging and supporting what Dr. Chant and we have been talking about today. And I encourage everyone, when you get off this call, if you haven't made an appointment, make an appointment with your GP or pharmacist. Go and get vaccinated. Otherwise, I'll tell Dr. Chant on all of you.
Thank you so much for joining us, Minister Park. And Dr. Chant, any last words?
No, just please take care this winter. Please access good advice, and just really my appreciation for the engagement and your leadership also, Jess.
Thank you. It is a team effort. Ministry of Health, the Multicultural Health Communication Service, with the support of Multicultural New South Wales, and all of us here would like to thank you for continuing to join us on these sessions and supporting the messages and delivering them to the community. We will be back in another fortnight with some important information on public health. But meantime, the recording of this session, please share it on your socials, will be available in the next few days, as well as on our social media platforms. Thank you again. Stay safe and get vaccinated.